As we come marching, marching in the beauty of the day, 1,000 darkened kitchens, 1,000 mill lofts gray, I'm struck by all the radiance that a sudden sun discloses, and the people hear us singing, bread and roses, bread and roses.
One of the things that I've learned about the art of nursing is it's so expansive. You need not only lots of academic abilities, an ability to analyze situations and critically think, but you also need that other spectrum of being able to be there present to people's lives.
We want our patients to be so vulnerable with us. We listen to everything, their entire life. We're with them, when they're possibly at the end of their life. We're there through their most vulnerable moments, but then we feel like we need to be that pillar of strength. But at the same time, through being vulnerable, you realize how human you are. And that one day, we may be that person in the bed, and we would want the person standing over us or next to us to be as vulnerable as we're being at that time.
You might share or get help from each other as far as a patient that you're taking care of, but as far as yourself, you don't tend to do that.
We need that as a team because we do get burnt out. We see a lot of horrendous things. We see good things, but we see a lot of horrendous things, and it's sad, and it's hard not to carry that over into our everyday lives.
As we come marching, marching, unnumbered women dead, with the ancient cry for freedom, comes the ancient cry for bread. Small art and love and beauty, their drudging spirits new. Yes, it is bread that we fight for, but we fight for roses too.
At the kickoff session, there was a great deal of performing and warm-up type activities that some people did okay with.
It's getting to know each other in a personality kind of way.
And some people, it really stretched them.
It's not my thing. Touchy-feely feelings, not my thing.
If you would have asked me after the first session, I don't think I would have wanted to keep on going on.
At first, I didn't get the games.
Several of us talked afterwards. They just thought it was weird, it was strange, it was uncomfortable.
It can be challenging.
I'm not an actress by any means.
At first, everybody was real nervous and didn't want to do it.
So I sat there scared to death that I would be called on.
Including myself.
I came in a little frustrated and a little angry that I wasn't sure that this was stuff I didn't already know and that I couldn't handle and do myself.
And finally ended up volunteering like a dumbbell. I got out there and volunteered and actually put on my own little skit.
So it wasn't until the third session that the light clicked on.
It's a break, it's a refocusing, it's play. And I think a lot of times in these kind of intense environments, we forget what it is to play. It's rejuvenating, it's a part of all of us, and we have to remember how to do that.
When you've played together, then your work experience is not the same. It got us to think about the things that happen in new ways.
As a nurse manager here, in the conversations I may have with a staff member or counseling I need to do, or just in general a conversation that may have not gone exactly the way I wanted it to, I've learned it was a performance.
Instead of personalizing a behavior, you can talk about it as a performance or maybe something you've learned.
I can go back to that person and say, can I just do this again?
That frees you up, I think, to then change that, look at that differently, change that performance.
I have a couple absolute fabulous nurses, but they have really short fuses.
In other words, it's not a a fault that's intrinsic to you personally.
It's kind of like, okay, you blew your fuse, but let's now, go back over, pick out another one and
change that performance and work on it and do it differently next time.
Performance of a lifetime gave me a chance to feel like I was contributing and to feel like I was being taken care of in this position.
Learning how to support is a skill, and I have found the coaching groups unlocking some avenues in which you can think about those things and work on them.
I had no idea that I would open up with my own personal feelings.
I remember we had a nurse who was saying she was completely frustrated and kind of to the end of her rope. And we were able to kind of discuss through that and talk about it.
But at that third session, when I voiced that, oh my goodness.
And, figure out what was really going on and where, and help her.
The outpouring of love from my colleagues.
I think that this really does a great job of facilitating that discussion.
I think I've been able to kind of in my daily practice now, get over some of those little petty frustrations.
When things are rough, we learn to work better as a team.
I guess maybe life is too short.
We're more accepting of one another.
It helps me better able to support my patients in their needs as they're going through treatment.
It allowed us to just kind of talk about those things that you don't always have time to talk about at work.
Well, this set aside the time.
Which gave us kind of an area to kind of come together and realize that all of us are dealing with a lot of the same things.
I think we were then better able to bring that back to our department and help those who were in need.
There were changes, really important changes that occurred.
It helped me grow.
Being open to listen and not just jump.
Before I make decisions, I think about it a little bit more, more from the other person's perspective.
I think it helps you to see the need to support nurses.
It's made a richer, more open environment on the unit.
In general, just being more kind.
If I were to sit down with the president of Johns Hopkins and talk to them about the resiliency work, I think I would be very proud to tell him that we're bringing our whole self to nursing.
The issue is caring for us, the caregivers.
I think it's so important to resiliency and to be able to do what they do every day.
As we come marching, marching, we are standing proud and tall for the rising of the women. The rising of us all. No more slaves, no more masters. Thousands toil while one reposes for a sharing of life's glory. Bread and roses, bread and roses. For a sharing of life's glory, bread and roses, bread and roses.